Hello, everyone, and welcome to this webinar today. We have over 80 attendees from over 30 countries across the world who are present. So welcome to everyone, and I hope you enjoy the event. My name is Nick Jukes. I'm the coordinator of InterNICHE, the International Network for Humane Education. Into the chat will be posted our basic housekeeping guidance. So please have a look at that in terms of how the event will progress. To tell you a little bit about this webinar series, it's organised by 3 organisations: the Johns Hopkins Centre for Alternatives to Animal Testing, CAT, the education programme, InterNICHE, my organisation, and ONBEON, the Centre for Animal-Free Biomedical Translation, CBBT. And this is really a follow-on, this series is a follow-on from the International Conference on Alternatives and Simulation in Education, which was an event that we and others organised in Rio de Janeiro, Brazil, at the end of August this year. And that was a satellite to the 13th World Congress on alternatives and animal use in the life sciences. So this webinar series will be monthly and will rotate in terms of the organising of the webinars between the 3 different organisations. And we'll be looking at real-world implementation, showcasing initiatives and transformations in 2 distinct but mutually supportive areas. Firstly, education through the use of humane, innovative learning tools and alternatives to animal experiments. This is a focus on acquisition of knowledge, skills and attitudes in student practical classes within biology, medical and veterinary medical education. The second area is progress in science through education and training in cutting-edge non-animal methods, or NAMs. This supports the next generation of scientists and others in research and testing in practically applying the latest scientific, technological and ethical innovations. We'll also be exploring the link between humane education and humane science and the pathways and diversity of options for ethical careers. So this webinar is being recorded and it'll also be edited and put online afterwards, and excerpts from it might be used within other resources. There will be certificates for attendees who are present for the full webinar. Now, before I introduce our very welcome speaker, I'd like to invite Dr. Daniela Salvatore to mention briefly the next webinar that follows on from this, so the January webinar. So Daniela, would you like to say a little bit about the forthcoming webinar for early next year, please?
Yes, thank you very much, Nick. Again, it is really exciting to see how many people are online and from many different parts of the world. Thank you. And in January, we are hosting a webinar actually from my research group on virtual reality and using virtual reality in life sciences education. In Utrecht, we have started a large experience developing and also deploying avatars of humans and animals. And I would like to invite you to join us in January and discuss together what is the best way to use this new technology that they can have such a high impact for students and, of course, for animals. Thank you.
Thank you very much. And at the very end, you'll share the link to that next webinar in January. So thank you for that. So for today, we're very happy to have the contribution of Dr. Crystal Heath from the US organization Our Honor. We'll be combining conversation and slide presentations on a number of different themes. Crystal is a Los Angeles-based shelter veterinarian and the executive director of Our Honor, a non-profit that supports veterinary students, veterinarians, and other animal professionals in speaking their conscience to create more ethical systems that consider the best interests of all species. And she'll be presenting on veterinary medicine, education, and courageous careers. So a big welcome to Crystal.
Thank you so much for having me.
So first, can you tell us a little bit about yourself and about your organization? How did you get involved in veterinary medicine? What were your passions that led you to both studying for this career and then setting up an organization whilst also practicing?
Yeah, I was always an animal lover growing up. I grew up in rural Northern California. I was heavily involved in 4-H, which, if you don't know, it's this university land grant system in the United States. And the purpose was to bring modern agriculture technologies to rural communities through their more impressionable children. But if you were an animal lover back in the day, in a rural area, 4-H was like really your only option. And what the kids do is raise animals for to sell at the county fair for slaughter. I ended up not doing that and doing some other projects, but we had horses and goats and chickens growing up. So I always had a passion for farmed animals, and then ended up becoming a conscientious objector to the consumption of animal protein as well. And so, of course, my animal loving path naturally led to pursuing a career in veterinary medicine. And then I got more involved in animal advocacy after I graduated, and realized the need for an organization that would support veterinarians in advocating for more effective methods of treating animals, because I was seeing veterinarians be bullied and smeared as so-called animal rights extremists for merely advocating for what we should be advocating for as veterinarians. And so that's how we came about developing the name Our Honor, because in 2020, it was a certain culture was happening in the United States where it was more of a conservative mindset that was occurring. And so we wanted to harness that conservative kind of spirit that was happening. And Our Honor really fed into that, because we were about defending our honor. Like here, we were being smeared and attacked for advocating for more efficient and effective methods related to animals. And here we're being character assassinated, bullied, and retaliated against. And so it was about defending the honor of veterinarians who were advocating for more effective methods. And so that's really how we came about. And we're really worldwide. We have so many supporters all across the world. So yeah, that's our story.
Excellent. And the issue of conscience, I think, is really important both for veterinary students and for veterinary practitioners, veterinarians themselves. That's something that you have linked in with, right? The actual issues concerning how students learn, as well as how vets practice and what they focus on.
Yeah, we're all about following your conscience. We, it's amazing how we have to do all of these studies to prove that like fish feel pain, when anybody who's swam in an ocean and seen fish firsthand know, oh, they're very similar to us, of course. But yet we have to, in veterinary medicine and science, we're often like taught not to have common sense almost. And you have to prove everything to a ridiculous level when we should just assume at the starting point, let's give the benefit of the doubt that fish and other animals are just like us, and not to anthropomorphize, but to prevent us from doing harm. We developed the ability to empathize with other animals 100,000 years ago as human beings. And we see other species of animals empathize and try to save other animals. And if you're having to betray your conscience, you feel it, because there's 100,000 years of evolution that causes you to feel that. So, we want to encourage people to follow their conscience in doing this.
And as an organization, Our Honor's got quite a significant social media presence. There's a lot of different platforms you're on with a lot of different areas of focus. Can you tell us a little bit about how you work and then what the different areas are?
Yeah, so we are focused a lot on farmed animals, of course. Right now, we have this unprecedented avian influenza outbreak. So we're raising awareness about that, the spread, how our political systems are incentivizing structures that have allowed for avian influenza to spread. We're talking about the cruel methods of mass killing or depopulation that are taking place, that are allowed by veterinary organizations. We also talk about the cruel methods that have been developed to foster more production efficiency in farmed animals, the use of gestation crates, pig slaughterhouse gas chambers, and of course, terminal laboratories and veterinary schools is a big focus. And we help support veterinary students who are trying to follow their conscience and be conscientious objectors to these cruel systems in their schools, and hopefully advocate for more effective and efficient alternatives, and so that we can create courageous and confident surgeons.
Indeed. And looking at animal use and the use of alternatives or humane teaching and learning tools in education, certainly we describe harmful animal use in education as in the broadest sense of any practice that limits an animal's current or future well-being. And these are examples of harmful animal use would be purpose killing for dissection, would be animal experiments or procedures, but also other instrumental animal use, which is neither a dissection nor an experiment, but is still involving harm with the animals within practical classes for veterinary students, and also sometimes medical students and biology students.
Yeah.
And as the first sort of major theme within this webinar, I'd like to ask you about the recent study that you published concerning terminal laboratories, bearing in mind that, of course, there's a lot of differences between countries, but mostly differences between different departments within veterinary schools across the world. Can you tell us a little bit about this study, this research you did, and the publication? What was the background to the decision to research this, and how did you go about doing it, and what were the results?
Our inspiration for this study was I had heard from students that there were all of these students who'd reached out to us who were concerned about having to kill animals in veterinary schools. And they're telling us, oh my gosh, this is thrown on us. We had no idea that we had to do this. And here we are being asked to kill animals in our labs. What do we do? And I'm talking to my other colleagues about this problem that exists. And my colleagues are going, we don't kill animals in veterinary schools anymore. This is not true. We fought for this in the 80s and the 90s. It used to be done. We used to kill animals in veterinary schools, but we fought against that, and now it's done. And I'm saying, no, there's students who are having to do this. So that's when we realized we needed to do this study to figure out exactly what was going on in these veterinary schools. And so that's kind of the inspiration for this paper that came about. And luckily, Ryan Merkley of Physicians Committee for Responsible Medicine was sort of thinking about the same thing. And he reached out to us and said, we're working on this project. We're getting all of the IACUC protocols from all of the public veterinary schools across the United States and Canada. And we're trying to figure out how many animals are killed in veterinary student training. And we want to know, how are these animals sourced? And I'm like, this is a great project. He asked me if I'd be involved. I'm like, absolutely. And then I recruited Dr. Robin Chadwin, who's a diplomat of the American College of Animal Welfare, who was also interested in this study. And together we worked for 2 years compiling this data on what veterinary schools are still killing animals for student education. And these are some of the results of that study. And you can find the QR code there to download this study yourself.
For people who are not from the US, can you explain IACUCs? These are the ethics committees within US institutions. Is that right?
Yeah, so this is the International Animal Care and Use Committee, or the Institutional Animal Care and Use Committee of each university. And in order to get approval for these protocols that involved animals killing or animal use, you have to have an IACUC panel approve it. And it's usually a veterinarian, another researcher, one member of the community, and a few other people. And unfortunately, I've also talked to a bunch of people who've sat on IACUCs. In human medicine. There's also institutional review boards. And there's a huge problem with bullying of the kind of, if there's dissenters against a practice, they often feel pressured to just approve something, or they are kicked off the IACUC committee. So there's this problem that exists with that structure as well. But yeah, we've found that the vast majority of schools were still sourcing animals in unethical ways. And I would say, like, what is an unethical way? These are often animals who are purposefully bred from biomedical supply companies, and they are then purposefully killed. Uh, we would like to see more, what you would call ethically sourced, which is animals who are free living, who pass away from natural causes, or their humans, guardians will donate their bodies, willed body program or something like that.
Then
Yeah.
separately, there's the working with live animals and animal patients, or is it experiments? So certainly those are the sort of areas where we can see sort of progressive change. But it seems that this study was surprising in terms of how much harmful animal use still continues.
Yeah, absolutely. And how we kind of evaluated these was we looked at how closely they are following the American Association of Veterinary Medical College guidelines for the use of animals in veterinary education. So they have this handbook for what they consider ethically sourcing, and it gives recommendations on the use of animals, and it includes guidance for both cadavers and live animal acquisition. And among the recommendations are using animals in a humane, respectful, and welfare appropriate way that is guided by the 4 Rs, which are replacement, reduction, refinement, and respect. And the guidelines also recommend that schools be transparent regarding the source and the use of all animals, cadavers, live animals, and be transparent with the students and the faculty and the staff. And we're finding that's not true. It's very much kind of sprung on the students last minute, so they don't really have a chance to really think about these things, process these things, and appropriately object to some of these labs. So
what sort of response did you get from the different universities? And we're talking about the US and Canada that were covered. Is that correct?
Yeah, so we actually reached out to all of the universities and we said, hey, we just published this paper. We found your school has these classes. These are the problems with your particular lab. There was only one university who actually replied back to what we said and said, actually, those protocols, yes, we agree that we were killing animals. And this was University of Wisconsin, who was the only school to respond to us, said, but those, just because we have those IACUC protocols doesn't mean we actually still do that. So we are not doing those labs anymore. It's kind of disappointing that all of the others haven't really responded to us, but I've since made a lot of social media posts about this, and I've gotten a lot of backlash from my colleagues about this paper. And there's a lot of, many are very offended. And not, I wouldn't say many, I don't think this is the majority of veterinarians. The majority want to see this practice go away. We want to see more effective, efficient, ethical ways of teaching. But there's a few who, they participate in these labs and they feel that these labs were so important for their training, and can't imagine students being denied the education that they got. And they are offended by the use of the word killing in these instances, saying that killing implies some sort of malice. And that is harmful to our profession. And instead, I should be using the word euthanize. And I say the word euthanasia should be reserved for the humane ending of a life of one who is suffering. These animals are not euthanized for these labs. They are killed. And killed, the definition of killed is just a life was ended. It doesn't imply malice. You were killed in a car crash. You're killed in a plane crash. It doesn't necessarily imply any sort of malice. So yeah, that's some of the backlash that I've run into. And a lot of veterinarians just can't foresee that, hey, there's a better way of teaching this. There are models and things like that. But also we can teach students under the guidance of experienced surgeons on animals who actually need these procedures. And that's what we should be doing. And I'll share the link to this paper in the chat too as well.
You were looking at both cadaver use and terminal surgeries in the paper, weren't you? Can you explain to people who don't use the term terminal surgeries what that means?
Well, terminal labs. So this means any time an animal is killed for a laboratory. And unfortunately, under our FOIA requests, our public records requests, we just only described looking for IACUC protocols where animals were killed either before or after the laboratory. And we also know that there are a lot of cadavers where the cadavers are purchased or they come to the school already killed. So we weren't able to search for that information of like where those cadavers came from, if they had already come to the school and they were already dead. So, there's a lot of cadaver use in veterinary schools where we're not able to really figure out where they're from or how they're killed. And this is true of a lot of the protocols that we looked at. The IACUC doesn't really require a lot of information from the students or from the principal investigator. So there's a lot of variability. Like we often couldn't tell where these animals were sourced from, whether it was ethical, and even how many animals were used in a lot of these studies or these experiments, these labs. It was, really up in the air. And we think there should be really set standards for these IACUCs. Like we should know where these animals come from, how many animals are going to be killed. But that just wasn't really that clear from a lot of the paperwork that we looked at.
Certainly from laws across the world, we can see that procedures, animal experiments, primarily in research and testing, are the ones that need permission, that are reported on, but animals killed before a lab or for other use are often just not recorded at all. So there is a major issue there, isn't there, in terms of transparency. At high school, in secondary school, might expect, do they know what they're going into when they become a vet? They're going in to help animals and suddenly they find there's an animal experiment in a physiology lab or a killed animal in anatomy or an experiment in surgery. Or training in surgery. And it's like you said, it's not what they're expecting at all. There isn't that transparency in terms of informing future students, but then also in terms of students who are there doing their courses, knowing what's going to happen even in the next semester or the next year. They're finding out from other students what might happen, and then they've got to face that.
Yeah, and they're kind of like put on the spot and don't have a chance to even plan and ask their professor, like, hey, I need an alternative, or do any research into this. So I think that's a little unfair for sure.
And then we find a situation where there's often a large number of students who feel discomfort at certain harmful animal use, but don't voice anything. They're young, they're under pressure. There's peer pressure too, and they might be explicit um, uh, negative treatment from professors
Yeah.
on a number of different levels, which can then also bring in and involve people's sexism, such as
Yeah.
someone being sort of too sensitive, in quotes, or too female. I mean, the use of harmful animal use in education often aligns itself with sort of sexist expectations in terms of how animals are treated and how you honor or deny your own emotions of compassion and empathy and so on. So there's lots of interesting dynamics here going on within the labs, aren't there?
So this is Dr. Stephanie Fraisel, and she was at Auburn University and was forced to participate in this lab where a bull named Fred, who was an elderly bull, would have multiple procedures performed on him and then be killed afterwards. And she was a conscientious objector to this. But Dr. Fraisel, she like suffered such severe bullying and was even failed in the class for being a conscientious objector and refusing to do this. And yeah, it is interesting because it's like what's sort of the manly thing to do is to be courageous and to, have values, but you're kind of it's weaponized against you if you are like, hey, no, actually, there's a better way to do this. We don't have to do it this way. Your whole way of going about it is reframed as you are too soft and you are too emotional and you're not cut out for this. When the people cut out for it are the people willing to stand alone while everybody else is minions going along with whatever the professor says, to be brave enough to stand alone and say, like, actually, this is outdated. There are better ways of doing this. That's kind of what we should be rewarding, and yet that's not in veterinary school. We are rewarding the people who follow along, do what they're told, and in this day and age, that's exactly the opposite of the type of character that we need to be incentivizing.
It seems to be more conformity than critical thinking.
Yeah, exactly.
What do you think can help motivate those students who are thinking about standing up, and how can they sort of understand what the potential um, risks and benefits and the pathway of what might happen as they object?
Yeah, I think we have to look at the history, and this is what our honor does is we share the stories of veterinarians who have been conscientious objectors, and they've gone on to have very successful careers. And yeah, that moment in vet school, they might have faced some backlash, but it was so good for their career otherwise, and it's good for the veterinary profession. And we also have veterinarians who are like, you know what, I didn't conscientiously object in vet school. I didn't even think that this was a bad thing. We just had on Dr. Kathy Strickland, who talked about she went to University of Mississippi and they worked on beagles that were sourced from a Purina lab. And there was this discussion of, well, we have these shelters full of animals who need care, and there's such a need for spay neuter. Why aren't we doing that? Why are we sourcing these healthy beagles from a lab because they're no longer needed and then killing them instead of adopting them out or anything? But that was, she didn't even think that it was a big deal at the time. And now that she's older, she realizes that this doesn't need to be done anymore. And I think students need to realize that there's a group like us who are willing to support them. They don't have to go this alone. And find if there's other students in your school who are in agreement with you, join together. But we'll also help you by writing letters to your school and getting them to acknowledge that this is a really outdated system that they're forced to participate in. And no students should have to continue to do this. And it's not just about one student being a conscientious objector. all of those other students who have to continue to do that lab while one student conscientiously objects, do they feel some sort of sense of guilt, or do they feel like they're not cut out to have the courage that that one student had? Do they become defensive later on and justify all sorts of other harms against animals because they didn't conscientiously object back then? It has all sorts of downstream harms for students. So it's not just about some students conscientiously objecting. We really need to change the whole system and get away from this model.
We also have a lot of student testimonies on the InterNICHE website, and I personally have heard a lot of stories from the past of hundreds of animals being killed for different labs within veterinary classes, but also a lot of very positive examples from teachers who have given up the practice of harmful animal use and have developed alternatives such as non-animal tools, or developed more clinical learning opportunities for their classes. And as I mentioned earlier, there's a lot of examples where teachers are making different decisions, because so much does come down to the individual teachers. In many countries where it's the individual head of department or the course leader who can make a decision about which tools and approaches are used within a class. In some countries, things are more centralized. The academic councils and other bodies have more control, and the teachers have less freedom for making those decisions. But in many countries, those decisions can be made for a different tool. And I think we have an alternatives database and a studies database on the InterNICHE website that really show a lot of examples of tools that teachers frequently have developed, sometimes with companies, and then reported on the development and implementation of these tools. So there's some great examples. I think for the US, people sometimes expect it to have some of the best practice approaches, and I think there are some really great examples of best practice in the US, but strangely, there's also a lot of examples of worst practice. It's a real combination of the best and the worst. Whereas, say, in the UK, the veterinary profession, the surgery is largely learned with models, mannequins, simulators, and then clinical learning opportunities. That doesn't mean there's no harmful animal use at all, but there's a general sort of cultural practice where things don't involve terminal labs, for example. That diversity is quite an interesting topic because, of course, people are generally learning the same thing. Veterinary medical education wise across the world, some differences in species, but generally it's the same thing.
Yeah, absolutely. And there are much better ways to do these sorts of things. And I just pulled up my slide, and here I'm teaching students in other countries. This is in Fiji and Oaxaca, Mexico, and the Navajo Nation. And here I'm teaching veterinarians and students surgeries on animals who actually need these procedures. And they're under the guidance of experienced surgeons. And a lot of people say, well, how dare you experiment on people's animals for student training? And to that, I say, after you practice on these models, high fidelity, low fidelity models, and get used to things like tying knots, putting on gloves, there's no reason why you can't jump in and tie a knot on a real animal, or dig in and try to find the uterus on an animal with the veterinarian watching you. And if you're taking too long or you're not doing it right, then I jump in and say, like, here, let me finish this for you. You got to get better at your skills before I'm going to let you finish. And that's how human medical schools learn this too. They don't kill humans to do this. And a lot of medical schools in the United States don't even kill animals for their training either. I think there's no animal killing in medical schools in the United States anymore. So if it's good enough for human medical schools, why isn't it good enough for veterinary schools? And there's some concern about the cost, but these labs involving the purchasing and killing of animals for student training are the most expensive labs. It just takes a little bit of different structure to have members of the community bring their animals for students to practice on, but it's such a needed thing. That's what we did at UC Davis. There are members of the community who need veterinary care for their patients, can't afford it, and they come to the veterinary school and understand that veterinary students are going to do it, but they're going to be under the guidance of experienced surgeons. And that's what I did, and we provided those animals with good pain relief afterwards, much kind of better in a lot of ways than what we even do in general practice. So they really got top of the line care. So it's not about experimenting on poor people's animals, which would be problematic, but it's about expanding access to care. And that's how students learn effective methods of veterinary education.
And then the non-animal methods that students are increasingly using in veterinary medicine, veterinary medical education, the models, the mannequins, the simulators, the task trainers, the software, including XR, virtual reality models, and so on. All of these are really developing fast across the world and have been for more than 20 years, but even in the last 10, 15, there's been some really major progress. Many new skills labs being developed within veterinary education, learning a lot from human medicine and the skills labs for students to be exposed to the different skill sets that they need to be gathering, and really using a whole range, as you mentioned, different degrees of fidelity of models, different levels of realism and complexity, so that students are beginning with, for example, for surgery, very basic models, a single layer suture pad, for example, to practice that eye-hand coordination, how to hold a scalpel, how to make an incision, and then how to work with the needle driver and suture, different suture patterns. All of these very basic skills which can be built upon for the more complex skills as they are practiced over the years within veterinary degrees. So I think these non-animal tools are really providing really excellent opportunities for students to practice with the right degree of with models of the right fidelity and degree of complexity for the different levels of their education, their skills acquisition, the chance to repeat and learn, to make mistakes and learn from those mistakes, and really master those skills before they go on to the next level of skills acquisition. And this really, I think, as you said, it really means that you can master skills, develop the confidence and the competence before going on to the next level. And in a way, I think it reflects a greater sensitivity to the learning process. You're really looking at what exactly you're trying to learn, not only the technical skills, but also the emotional aspects. You know, are you dealing to learn in a stressful environment? Are you learning how to manage stress in a crisis or in an emergency situation? You know, all of these scenarios you can practice. So it's really something where I think you've got such enhanced opportunities through the development of these different materials for people really thinking about teaching objectives, learning outcomes, skills, and the skill sets. And then after you've got to that stage, working with patients. And like you said, it's not an experiment. You're not primarily practicing on the student, on the patients. What you're really doing is contributing all those skills you've got to that point and working under supervision and gradually being apprenticed into it, right? You're starting off with observation, then you're involved in the first interaction with the patient, meeting the client, seeing the whole of the situation in the clinic, from discussing with the client, practicing that work, trying to find out what is wrong with the animal, if there's a family problem linked to the illness, and seeing the whole operation, contributing to it, then recovery, post-operative care. You're really seeing something much more realistic than what you might face in a terminal lab, right?
Absolutely. And you get to monitor post-anesthesia recovery as well, which is what's missing in terminal labs. And you don't have that, you're not doing it with that intensity of like, this animal is going to live afterwards. I cannot mess up here. Um, and I have to explain to their person, their human who's going to care for them, how to manage their care afterwards, how their recovery is going to be. And I get to see the next day how that animal is feeling after this surgery and if they need more pain meds or if they need some sedation because they're jumping around and feeling a little bit too good. And those are all vital things that students need to address. And complications. Is there a seroma afterwards? Or did my incision site dehisce, which shouldn't be a thing if a good veterinarian was overseeing the practice. But you know, every now and then an animal will get their e-collar off and start chewing the incision, and then you have to deal with the dehiscence. And those are things those vet students need to experience before they experience it in clinical practice. And that's what these alternatives give, and these access to care models where students are actually learning on real patients. That's what the students benefit from. And yeah, we can also talk about like farmed animals too. There is such a lack of veterinarians caring for farmed animals in sanctuaries and out on in production medicine. And we also need veterinarians who are confident and courageous, who might not want to work in food animal medicine, but want to advocate for the welfare of food animals, animals raised in these production systems. And it would be great if we had more veterinarians who can say, yes, I worked on these farmed animals in veterinary school or even beyond, and now I have the experience to advocate for their welfare and to advocate for better policy for them as well. And giving these more of these opportunities by providing access to care to all of these species is so vital.
And of course, it's a really huge difference working with a student working with terminal surgeries, which is it's not a clinical situation. It's a contrived situation
Yeah.
with involving animal harm. Of course, the animal doesn't benefit at all, may well be killed at the end. The student could learn in a better way using the non-animal models than working with patients. And working with patients is that therapeutic environment. So we're talking about working in the community with animal patients, companion animals, for example. It's a therapeutic environment, isn't it? It's like it's very different to something in a lab where harm is being caused. What are the advantages, do you think, of having such a therapeutic environment, and what are the options for students to work within that sort of context for example, surgical training and other clinical skills acquisition?
Yeah, so one great opportunity is what I did in veterinary school was I volunteered at my local shelter and I performed spay neuters on dogs and cats there. We had a community cat program where we did 100 cats a day, and these were community cats. And we do spays and neuters, and we had the shelter veterinarian overseeing all of our surgeries. But these are community cats, so they have a wide variety of conditions too. So some would need have a bad eyeball hanging out of its socket, and we'd have to remove the eyeball, or they need a tail amputation, or a leg amputation, or a mass removal, or a wound repair. And so the students got the opportunity to provide care for these community cats. So that was a great opportunity, and I really think more veterinary schools should utilize those. And those programs are expanding too. But other than that, there are sanctuaries who need veterinary students, they need access to care, and they could, by partnering with universities, students can come in and provide care for those sanctuary animals too. And a wide variety of other settings, just expanding low-cost clinics. So we had this community surgery program at UC Davis where people would bring in their animals, and we did a mastectomy, FHOs, all sorts of different procedures on these animals for $500. And that's what they paid. They understood the students would be doing the majority of the work, but it was all under the guidance of experienced surgeons. So that's another way that they can get that sort of experience as well. There's so many ways to create confident surgeons, confident veterinarians without needlessly killing animals.
And you've talked about shelters before and sanctuaries, and I guess with both of those, especially sanctuaries, you have a wide range of animal species too. And if you have a cow or a horse in a sanctuary, an animal who needs intervention, and the students can be part of that supervised intervention, then that's very different from linking a veterinary school with a farm, for example, or another sort of industrial system, isn't it? Because you have there may be less animals. We can address that in a moment, and opportunities, but it's very different from the link between a veterinary school and a farm to a sanctuary where it's a rescue environment.
Yeah, absolutely. Because on farms, like there's this financial incentive ultimately for the producer to profit from the animal. And often if they require anesthesia or other medications, that would mean that there's either a drug withdrawal time or something like that. There are these problems with the way that animals are produced on farms, where sanctuaries, there's so much more flexibility in how we could treat these animals and the medications that we can give. We don't have to worry about withdrawal times. Although sanctuaries, there still is this problem of like there's certain antibiotics that we are not allowed to use in sanctuary animals because in the United States at least, because they are an animal who is a species that is usually used for food. So like we can't use enrofloxacin in poultry birds, for instance, which it is a problem. But yeah, there are so many opportunities to let veterinary students know you don't just have to accept the system as it is. We can change it. And a lot of students might feel compelled to rescue animals. A lot of schools still will source animals from slaughterhouses, and they think that this is ethical because these animals would be killed anyway. But to the student, they're like, well, I have this live animal in front of me who we're going to kill after this procedure, but I could take this animal and they could live out the rest of their life in the sanctuary. Why are we doing this? Why are we killing this animal when they're in front of me alive? I have the moral obligation to ensure that they live a happy, free life, but I'm being forced to betray my conscience. So yeah, that's another problem with the current system that exists. But so many sanctuaries need care, so many opportunities for a variety of different animal species to get care through veterinary students.
Many veterinary students, of course, have no interest at all in going into working with animal production. So there's major questions about the relevance of some large animal work for those students. Do you see the sort of companion animal medicine field growing, and do you think students should be able to choose at an earlier stage where they focus, and which in turn will affect what might happen within practical classes?
Well, here's the problem is right now, if you are a companion animal veterinarian, the field says you shouldn't have a say in farmed animal welfare and you need to stay in your lane. And the farmed animal veterinarians, at least in the United States, only make up about 6% of our field. And we need to empower more companion animal veterinarians to take an interest in farmed animal welfare and have a voice in setting policy related to farmed animals that is more effective, more efficient, better use of animals. And I'm talking about we need to scale down our use of animals in food animal production. And the only way we're going to do that is if we get more veterinarians to say this is absolutely necessary. And so we do need veterinarians to own the fact that their degree allows them to have a say in all species. And so I don't think that there should be a separation between veterinarians who are companion animal veterinarians and veterinarians who are food animal veterinarians. I think they should have the knowledge in all of those species. And should, I think right now a lot of schools are trying to move away from forcing all students to go to slaughterhouses and watch how these animals are killed, because they realize so many students, when they see this, are going to have objections to it and then tell their friends like, hey, I actually watched an animal be killed and it was horrifying. It's not actually humane, or, not actually what they want you to say. And they're worried about that. So they want students to not do those slaughterhouse tours and only have the small percentage of farmed animal veterinarians do those slaughterhouse tours, and not have, and the other students are, just taking their farmed animal classmates' word for it that it's done humanely. And so I would like to encourage all veterinarians to take an interest in how all species of animals have to live in this world, and have a perspective and a say in it, and have some authority in it.
Thank you. Yes. When it comes to science and research and testing, there's been a lot of really great developments in the field of non-animal methods, or NAMs, organs on a chip, organoids, and AI, particularly within toxicity and for looking at sort of efficacy and safety of new drugs, for example, but also the beginnings within pure research too. And I think related to that, it's also important to recognize that people can contribute in many different ways. You might have skills within anatomy, physiology, programming, graphic design, even marketing and the legal world. There's a lot of ways that people from different backgrounds and with different training can contribute to, in this case, the development and implementation of NAMs within research and testing. One other area, of course, when we think about the different career options open to people from multiple backgrounds, but also in particular now for this webinar from the veterinary field, is other expressions of research, other approaches to research. And I know you've got some thoughts on clinic-based research, looking at studying spontaneously occurring disease. Can you tell us a little bit about this area where research doesn't rely on animal experimentation, and where we can sort of look at the situation and the opportunities within the clinic for research, but also as a career option?
Yeah, absolutely. So I think right now we are investing far too much resources and funding towards vivarium-based research and research on animals who are confined in laboratories, knockout mice, all of this. And this H5N1 outbreak that we are currently experiencing, this worldwide avian influenza outbreak, really brought to light how that has failed, because we have tried to replicate how dairy cows are infected with H5N1 in the lab, and have been unable to replicate it as effectively as when a small research team went out into the field and actually looked on the farm and tested individual cows, individual quarters of the udder, and discovered how actually this virus was spread and characterized on the farm. They were finding that quarters of the udder that didn't have mastitis were infected with H5N1, when they never realized that that could be possible with their experiments in the laboratory. They realized that this virus was spread through respiratory droplets cow to cow. This virus was everywhere on the farm, so prevalent, and just 1 milliliter of infected H5N1 infected milk has up to 1 billion virus particles. And it's stable. It's more stable in this milk that is from infected cows. If they tried to purposefully inoculate milk from healthy cows in a lab with H5N1, it didn't stick around as long as it did in the milk that was naturally infected. And there's so much of this research that we're not doing. I see patients come in all of the time to my clinic who are like, sick, we can't figure out what's going on. They don't have the ability to pay for all of the diagnostics that they want to run. And of course, people are complaining right now of like, oh, these veterinarians these days want to run all of these tests and rack up the bill. But that's how science is done. We do tests. We want to run panels. We want to see. We want to do a CT scan or an X-ray to actually look, because if you don't look, you don't find. And right now we are not finding so many things because so many people and animals don't have access to diagnostics. So if we directed, in the United States, $24 billion a year we spend on animal research, publicly funded animal research. And to put that in perspective, Americans spend $38 billion a year on veterinary care for their companion animals. Plus, we spend $38 billion a year on subsidizing animal-based protein production. And right now with this avian influenza outbreak, we're testing all of these cows and all of these chickens. If you have a sick cow or chicken, your H5N1 test is free. But if you have a sick cat and you come to the lab and we wanted to test that cat for H5N1, it would cost $400. And likely that cat got H5N1 either from potentially raw contaminated poultry that was commercially sold to them, or a raw milk that was sold over the counter, or some bird that possibly got infected from coming into contact with dead dairy cow carcasses or milk or something like that, or a fly that was spreading H5N1. And these are things that we're not discovering. We're not discovering how prevalent H5N1 is in dogs and cats because we just aren't testing for it. And that's what I would like to see more of as the future of research, more epidemiological and testing research. And there's also clinical discoveries that we've made. We can do clinical trials. There's so much clinical trials going on in clinics where animals get access to new treatments, but they're part of a study. And there could definitely be more of that we're just not doing.
So really a lot of potential that's not being missed through the what we perhaps could call misallocation of funds in terms of
Exactly.
What techniques, what approaches are being used, but also just a huge resource of animals that are ill already, whether it's a pandemic or other spontaneously appearing diseases. A lot of data as well, and opportunities for clinical trials within, of course, the rights of ethical framework, where we could really have a different approach, and perhaps not only benefit those individual animals, but also progress science in terms of this different approach to research.
Yeah,
I
absolutely.
think also within sort of human medicine as well, we have a similar situation. Firstly, you have animal experiments being done a lot within the research and the testing, but also we have a huge amount of spontaneous disease that could be studied, populations, epidemiological studies, and then of course the big one of research that involves human tissue, human relevant research work and testing. And I think things are shifting now after people realizing that the animal experiment really wasn't the gold standard. It was always an approach that involved some visible tarnish, but no one had really said, okay, is this actually the best way of doing things? So some very good progress, I think, in terms of new technologies, AI potential, but also a gradual crumbling of what was assumed to be the only way or the best way of doing things in the past. But when it comes to human medicine, we have that issue of human biology. But I think at the same time, and it might appear paradoxical, but we also have something where both veterinary medicine and human medicine can learn from each other. So the approach of one medicine, which looks at how you can learn across these fields, how you can learn about different techniques, how some data might be relevant, whilst bearing in mind the crucial aspect of species differences. But I think there's a lot that can be done in a different way, and I think the studies and the approach you've mentioned regarding bird flu, for example, is one area where you can see that so much can be learnt and there's a lot of potential.
Yeah, absolutely. And we're kind of just taught this, come back to having issues with animal experimentation is, well, if my kid was dying of cancer, I would be totally fine with sacrificing animals so that their life could be saved. But yeah, a lot of people would literally sacrifice other people's kids too so that their life would be saved. That doesn't mean it's the way to go. But I also know so many people who have loved ones who were going through a terminal illness, and they wanted to be able to participate in studies and were not able to for various reasons. And they felt that they were denied potentially life-saving treatments because of the barriers in place to human experimentation as they exist. But also, there's a lot of people doing biohacking right now on themselves, doing all of these things to try to promote longevity in their life. And they're doing kind of these self-experiments. And if there was a better structure for humans to do that, humans have always, tried to innovate and make discoveries. We traveled across the planet, we go to war, we go into space. A lot of people would be interested in participating in these studies to be on the forefront of scientific inventions. And I think we should do that, but of course, in an ethical way where consent is promoted. But there are people who are interested in doing that, and we should let them.
I completely support the area of looking at working with epidemiological studies and looking at disease that there already as another way of taking research forward. Perhaps at this point we should have a look at the area of One Health. I know that's something quite close to your heart in terms of both the sort of benefits that are common to animals and humans from an approach that takes everything into account, that looks at the interconnection and so on. Could you tell us a little bit about this area and why it's so important for veterinary medicine, but also looking beyond at human medicine and the broader environment?
Human, animal, plant, and environmental health are all interconnected, and we know this. And if we harm one species, plant, animal, it affects us all. And that's what we are seeing with this unprecedented avian influenza outbreak. Because of our increasing dependence on animal-based protein, it has led to us confining thousands of animals in these concentrated animal feeding operations, genetically similar animals who are highly stressed, in close proximity with humans. And this has allowed for zoonotic diseases to jump species. And we've been worried about this for a long time, that potentially an avian influenza virus could infect, jump from animals to humans. And we saw this with the H1N1 swine flu outbreak. This was an avian influenza that infected pigs and infected workers and led to a pandemic. But we've seen this the Spanish flu, various influenza pandemics throughout the past century have all occurred because of our relationship with animals. But there's also the problem of deforestation. We are deforesting land in order to clear land for animals to graze or grow crops, grow feed crops. That is putting us in an interface with wild animals that allows zoonotic diseases to jump species into humans. So it's both that problem and then also the intensification of animals in confined feeding operations that leads to this as well. But the previous model of veterinary medicine was this hierarchical view of the man at the top and then women below him and then species in order of their moral concern to us ranked below that. But we really need to switch to this more biocentric view and understanding that whatever we do to one species does end up affecting us all. And we even see this with potentially animal experimentation. There are various lab leak theories that occur, but we have seen this with Ebola and Marburg virus and all of these other viruses that have escaped the labs, and that has led to issues. And the veterinary profession has allowed cruel practices to continue that facilitate corporations that confine animals. So with this avian influenza outbreak, one of the most common methods of mass killing is ventilation shutdown, where they seal up the buildings of infected animals, pump in heat, and wait for the animals to die. And that was a study. In order to legitimize this, a study was done at the Prestige Department of Poultry Science at North Carolina State University. This was industry-funded study that was then used by the American Veterinary Medical Association to set policy, their depopulation guidelines, which is used by the United States Department of Agriculture to determine who gets funding when animals are killed using these methods. So ventilation shutdown is an approved method under constrained circumstances. So these corporations that don't put plans in place to use less cruel methods, and these are often the biggest corporations, are able to do this to animals. But who really does the AVMA represent veterinarians? Most veterinarians? No, they are representing their corporate interests. These are Merck, Boehringer Ingelheim, Zoetis, Cargill. And if you don't know, Merck is a pharmaceutical company, as is Boehringer Ingelheim, Zoetis. These are pharmaceutical companies that make a lot of their profit from selling medications, vaccines, antibiotics to slaughter-bound animals. Cargill is the largest private agribusiness company in the world that makes a lot of their money from selling feed crops to animals, as well as selling animal-based protein. So these are the interests that are guiding the AVMA, not the interests of animals. So to explain how the cycle of money works, Prestige Farms, a big agribusiness corporation, gave money to North Carolina State University to do this ventilation shutdown study that was then used by the AVMA to allow their ventilation shutdown to be used in the guidelines, which dictates USDA policy, which then allows the USDA to give money back to the very same corporation that initially funded the research in the first place. And that's not fair. It's a never-ending cycle of research being used to facilitate worse animal practices and confinement, and practices that make it profitable for them to continue these dangerous practices. And in the United States, this meant that these companies, these billion-dollar companies, got millions of dollars in bailout money for killing their animals this way. And so this is a huge problem, and led to what we have now is avian influenza infecting now dairy cows. And I went to the Central Valley of California and took the first images of sick and dead cows that were infected with avian influenza. And this story made international headlines. Previously, the industry was saying, don't worry, this avian influenza in dairy cows is a minor illness. They recover from it. Don't worry, the milk is safe. We want to maintain consumer confidence in this industry. And my footage of piles of dead cows lining the sides of the roads forced them to change their narrative, and they were forced to say, actually, so many cows are dying from this that the rendering trucks are backed up. And I think that's the responsibility that veterinarians have, is to confront the industry and say, actually, this is a huge threat. 1 billion virus particles per milliliter of milk in these infected cows. Tens of thousands of poultry birds could be infected with just 1 milliliter of milk. And in California, we have 2 million bird egg facilities right across the street from 5,000 dairy cow facilities. And we've seen a dairy cow facility get infected, and then a few weeks later, the 2 million bird egg facility had to be depopulated. And this is a cycle that will happen over and over and over again across areas where this virus is. And of course, workers are getting sick. There's not adequate testing of the workers. They are worried about deportation. They're worried about retaliation if they test positive. And so we don't really know how many workers have gotten sick, but it's been reported that a lot more workers are getting sick than what the media is reporting. So I'll leave it at that for now.
How else would you say that corporate interests are detracting at best and corrupting at worst the practice of veterinary medicine?
Well, there's also a lot of bullying and retaliation of veterinarians. I have been smeared and attacked online for even daring photograph these facilities. We are being prevented from even sitting on committees at the AVMA. I was barred from attending the AVMA's Cargill-sponsored Humane Ending Symposium. So they purposefully prevent our voices from even being present in the room where these things are being made, or these decisions are being made and these things are being discussed. And that is a huge problem. It's this very isolating experience. People who do voice concerns are purposefully being marginalized and pushed out and not allowed to have a say in how policy is made.
And of course, there's other broader issues with management, centralization of independent veterinary practices, mental health of veterinarians as well.
Oh, yeah,
so there's
absolutely.
quite a few issues that veterinarians are having to face at the moment.
Yeah, there's the private equity buyout of private practices. So now veterinarians are forced not only to just make enough money for the clinic to run and to pay the employees, but now we're having to make enough money to pay the executives who run these private equity firms and their shareholders, which has led to the rising cost of veterinary care, which means fewer people can afford veterinary care, which means people are relinquishing their animals to the shelter. And so that's a huge problem as well. And most people can't afford the cost of veterinary care, which is why access to care is so important. And that's what I'm really passionate about.
So tell us a little bit more about that and about the veterinary oath, courageous careers, and what the options are, including perhaps from your own experience with companion animals. What are the positive options for veterinary students as they graduate, and for veterinary practitioners who might want to think about other ways of more closely following the oath within veterinary medicine?
Yeah, absolutely. So right now I am working at a clinic that receives public funding from the city, and it saves the city money if we are able to provide care for animals who otherwise might end up in the shelter. So it costs the city $900 to $2,000 in order to shelter an animal when an owner relinquishes them. But if we could spay neuter them, prevent animals from being born, provide dental treatments, mass removals, vaccines, flea prevention, things like that, we prevent future medical problems. That ultimately means fewer animals in the shelter. So that's one really great career that a lot of people could have the opportunity to participate in. So my goal as a shelter veterinarian, and I also work in animal shelters too, but I also often found animal shelter work can sometimes be very unfulfilling, but it is so needed. I found the best use of my time was to spay and neuter as many animals as I can to prevent those animals from entering the shelter. So my goal is to make sure that we create a world where there's not a need for shelter veterinarians in the future. The veterinarian's oath says that being admitted to the profession of veterinary medicine, I solemnly swear to use my scientific knowledge and skills for the benefit of society through the protection of animal health and welfare, the prevention and relief of animal suffering, the conservation of animal resources, the promotion of public health, and the advancement of medical knowledge. I will practice my profession conscientiously with dignity and in keeping with the principles of veterinary medical ethics. I accept as a lifelong obligation the continual improvement of my professional knowledge and competence. And that's something we should all strive to do as veterinarians. this is what it looks like at our clinic. Let me see if I can play this. When we will do anywhere from 50 to 100 animals a day that we spay neuter at this clinic. And we can do it very efficiently, effectively, and provide care for these animals in a very safe way. And we just need to expand this model to more areas across the world too. So I think this is something, teaching is another really important thing. And I spend part of my time teaching students and veterinarians how to do high quality, high volume spay-neuter surgeries as well. I think there's also an important role for veterinarians in regulatory bodies. Like we have the USDA, United States Department of Agriculture, that inspects facilities, and far too many facilities are getting away with criminal activity, quite frankly. And we as veterinarians should get those jobs so that we can shut them down. And this is what Dr. Pat Basu, who was the former chief veterinarian of the Food Safety and Inspection Service, said. He said, when it comes to power, nobody dares to stand up to the pork industry, not even the US government. And this was an article that he did with the New York Times about the growing infectious disease that he was seeing, salmonella outbreaks and things like that. And as somebody who works for the Food Safety and Inspection Service, you can shut those things down. And he talked to me about, but the problem is veterinarians who do try to enforce the law are often relegated to district offices. And that's where you need to be a whistleblower, and you need to speak to the media and let them know that the system is not working as well as it should. We are led to believe that these things are highly regulated, but in fact, the regulators are being pressured and pushed by the industry to not do their jobs. So
what does it feel like for you to be a vet who is campaigning, who is making courageous choices to help animals and to help the profession?
It's really fun. A lot of people say, oh my gosh, aren't you scared? I could never. And I'm telling you, it's so relieving to just be able to say what you actually think and not be worried about pleasing people or being political. And that's so much better of a feeling than trying to fit into a box or a mold. So I just encourage everybody, follow your conscience and say what you think, because that's so much more fun than trying to say the right thing or do what you're told. So we have this, we help veterinarians and advocates connect, and we have veterinariansunited.org, which people can check out if they want to, and find out more information about the various campaigns that we're doing. You can also reach out to me with any questions as well, cheheath@rawhonor.org. And any veterinarians who want to join can join our network as well.
Thank you very much. I'm going to pass on to the attendees who may have some questions for you. So if you're listening and you have comments and questions, please put them in the chat now, and I can pass those on to Crystal. But we've certainly had some really good food for thought, some vegan food for thought, and some other great comments about things. We have a comment from Vanessa regarding how that really relates to some situations, some examples in Brazil. Katie is asking if vet techs can also join Vet United, and you've answered that.
Yes.
So that's fine.
Yes.
Actually,
anybody can join, not just veterinarians, advocates, anybody interested, everybody can join.
Of course, this whole webinar has been recorded, so that will get shared in some time this year. So we'll be able to get that out to everyone, so you'll be able to see everything again. We have a comment that there's been centres set up in the Middle East for VetSim, but in different countries it's harder. I understand that you're talking about, Ashraf, you're talking about skills labs, and certainly there are differences between countries. I think the comment earlier about the question about cost is important here, but really not only are some very basic clinical skills and surgical non-animal models very, very cheap, but also there's the potential for local production of tools. So, working with basic silicone and having local production not only can encourage local economic activity, but it can also avoid the need for buying and sending products across the world. And 3D printing is another option here in terms of where there are some very cost-effective ways to produce models. Some of the more complex and high-fidelity models, of course, are very expensive. The Sindava canine, which you can watch on the InterNICHE website, a documentary film about, is expensive, but it doesn't mean it's not affordable by many faculties. And of course, you can also share tools between faculties and cut costs in that way. So I think there's a lot of options there. And as Crystal has explained, there's some great opportunities working with animal patients, which are in many ways free. You have patients with disease, with injuries, and you can actually work with those animals after working with the non-animal tools. So there's a lot of opportunities, I think, for animals and what we would call ethically sourced animal cadavers too.
And if you have live animals that you can get for free, you can have live animals that you can keep alive too. It isn't that it's cheaper to keep the animals alive than to inject a euthanasia solution into them, I think, personally.
Yeah, and of course, this is then linking with the veterinary oath. If we're really talking about veterinary medicine, we need to look at how this works. There's another question, comment, wonderful seminar. What's the current state of development of organ-on-chip technology for veterinary applications in the US? I don't know, Crystal, are you able to talk about that sort of research and testing within veterinary medicine?
I don't know.
Is that something where we need to look for a future webinar?
On chips. Yeah, maybe future webinar for sure.
Yeah, I mean, there is some good progress in this field, perhaps more progress at the moment within human medicine, but some of this technology is very easily transferable between species and non-animal tools for research and testing that can be adapted and used in different areas. So there's a lot of opportunities for sort of interdisciplinary, cross-disciplinary learning and application. So I would say have a look at journals such as Altex and ATLA, where there are developments reported on. The World Congresses, of course, there's some good information coming out of the events. But have a look at the journals to see how that's sort of developing. AI, of course, also in terms of big data and management of information and using that data is very, very good. So I think that's excellent opportunities there within both fields. Before we close, and before I thank you again, Crystal, I'd like to bring back Daniela Salvatore, who's just going to mention the next webinar. She's put it in the chat there. So Tuesday, the 13th of January.
Yes, indeed, Nick. Thank you very much we are ready to announce the third webinar of this series, and it will be on the 13th of January, same time for us at 7 o'clock, but in other countries it will be different. So please join us. I think that we continue what Crystal has started this evening, looking for other methods without harming animals.
Thank you very much. And there'll be a monthly seminar rotating between the three organising in groups with animal use and alternatives and education, education about and training in NAMs for research and testing, and the ethical careers angle, which are going to be explored each month between the different organisations. So I think that's the end of the webinar. Any last minute questions? I think we've covered everything now. So let me say thank you very much again to our speaker, Dr. Crystal Heath from Our Honour, for some great exploration there of veterinary education, veterinary careers and issues within veterinary medicine as a whole. And thank you also to the other organisers and helpers for the webinars. There's people in the background who've all played a role in this. But there's lots of positive comments coming from people about the webinar. So much appreciated, Crystal. And thank you everyone else for helping, attending and participating. And we'll end the webinar now. Thank you very much again.